very good evening to all of you. I am Dr. Manisha. I am working as a medical lead in the Medical Affairs Division of Lupin. So, on behalf of my division in Lupin, I extend a warm welcome to all of you in this brief discussion on patient awareness program of PCOD and mental health diseases. As a part of celebrating the PCOS Mental Health Awareness Program, our team has brought together distinguished personalities and various eminent figures from psychiatric field to celebrate this awareness month, September month program. It is essential to spread the word about this condition, and it's a challenge for women from challenges for the women. And we'll hear all these thoughts from our eminent experts in the field. So, joining with me today in this program is Dr. Sujata Bhattacharya. She is very well known, renowned psychiatrist, and she had seen many patients related to psychiatric disorders in PCOD and other conditions as well. Welcome, ma'am.
Good evening. Good evening, everybody. I'm Dr. Sujata.
Yes, thank you, ma'am. So, as we are aware that polycystic ovarian disease is a complex condition and it impacts various types of the aspects of person's health. So, I would like to pose some questions about this, ma'am.
Yes,
So,
yes.
what do you think? How PCOS affects the women in general, and is there any connection between PCOD and mental health diseases of a woman?
Yes, of course. PCOS is a condition which is a hyperandrogenic state in young adult or in adolescent or in female with childbearing age group. Uh, Mental health problems are more common in female with PCOS, especially depression, anxiety, social phobia, bulimia, eating disorders, uh, psychological stresses. These are the common mental health illness that occurs in females with PCOS. Actually, two-thirds of the females suffers from obesity, and these lead to multiple psychological problems. Depression occurs almost 3 times more in females with PCOS. That is actually 19 to 25% of the patients with PCOS suffers from depression, and almost 35 to 39% of the females suffers from anxiety. Mental health disorders are more common in patients with PCOS.
Right, ma'am. So these patients, how they generally present to a clinicians to detect that these conditions are worrisome and this needs to be treated by a psychiatrist. So how are these common symptoms generally patient presents with?
Actually, these patients, there are visible signs of PCOS in female young females, like there is skin conditions like acne, alopecia, hirsutism, which causes emotional distress. And there is stigma associated with PCOS, like what will be the future, what will be the consequences of the PCOS, like there is menstrual irregularity, subfertility, obesity, and these leads to depression and anxiety. PCOS is also called the thief of womanhood. There is a common belief that the person who suffers from PCOS is not feminine enough, or they are not attractive enough. This causes a psychological stress to the patient. And there are biological mechanisms also, like hyperandrogenism, insulin resistance, which causes depression. And this anxiety is very common in case of females with PCOS. There is negative effect, there is interpersonal sensitivity, and they are very they are suffers from low self-esteem and low confidence level. There is body dissatisfaction due to this unfeminine. They think that they are unfeminine, and due to their obesity, they think they are very much conscious of their weight, their size, and there is body dissatisfaction symptoms. Weight concern is an important thing. There is negative body images, and there is less attraction towards opposite sex. Cultural influences are there. Like in West, they think that overweight people are not attractive enough. They are not good, And these are the things. And there is social phobia is also an important thing. They feel they suffer from rejection sensitivity, interpersonal problem will be there, and there is eating disorder is common in this group of people. Eating disorder like bulimia, they eat a lot and they vomit, they purge to decrease the weight. They go to they resort some strict diet control, which is not good. These are the things that they suffer from, and these are very serious things, and they should be addressed.
Yes, yes. So very rightly said. So these are basically all the symptoms. Being a woman, these are considered as very distressing for any
Yes,
women. So this is very important that otherwise also there is a social related stigma and stress associated with women's life. And when certain diseases comes into picture, they again become more worrisome and become more distressed about the symptoms.
yes.
So very rightly said. So, is there any management? Do you think it is important to manage such conditions from mental health perspective? And what are the treatments available for that?
Yes, of course. The treatment should be multimodal in approach. That means multidisciplinary team should act, like mental health professionals, nutritionist, gynecologist, and sometimes dermatologist and endocrinologist should all work together for this patient. There should be psychological screening. First, there should be psychological screening through some questionnaires. There is patient health questionnaires, 9%, which detects the depression and anxiety and other psychiatric disorder, and that should be treated with pharmacotherapy along with psychotherapy. That means counseling. The concern, the weight concern should be treated, and they should be specifically instructed, not like that they lose your weight. That will not do good, and that will cause poor outcome. We should give specific instruction, and they have some nutritional food, low carbohydrate, high protein, fruits, vegetables you should take, and do not go for strict diet control, short term diet control. Go for moderate and average weight control, and you should take it long term basis. And patient should be counseled that they should accept their size. And other things that is important is psychotherapy. They have to cope with this type of disease. This is a long term disease, and this should be uh, they should cope with this stress. And their outward appearance sometimes matters. That means acne, vulgaris, hirsutism, that alopecia, that should be treated, and if needed, dermatologist should be consulted.
Very rightly said, ma'am. So, at the end of this session, what is your final message? How you will conclude this session, which will be beneficial for our viewers also, the importance of having this mental health awareness among the patients suffering from PCOD?
Yes, actually, PCOS is a chronic disease. So one have to have some coping mechanism with this psychological, and they should face some psychological stress. They should cope with this. They should have proper diet, some exercise, nutritional foods, and if needed, they should consult psychiatrist or psychologist to treat their psychological ailment.
Yes, thank you, ma'am. Thank you very much for
Thank
taking
you
the
all.
time out and coming here. And in the benefit of patient, you all come from your busy practice here and sharing this knowledge only and only because of you feel like patient should be benefited from this mental health awareness program. So I'm really very thankful, grateful for you, and thanks for sharing all valuable information with us.
Thank you all, and namaskar.